Well, good afternoon, everyone. My name is Carol Scott, and I'm the Field Operations Manager for Advancing Excellence. I want to thank you all for joining with us today in the first of a three-part series talking about the Advancing Excellence, Safely Reducing Hospitalizations goal. Joining me today will be Adrienne Hellick. Adrienne works for the Analytic Unit at CFMC in Denver, Colorado. And she will be going through all of the tools and how to enter the data and everything. So first thing I want to do is, first thing I'd like to do is just mention that we are very happy to have you online today. We have almost 800 people registered. The goals of the session today, we really hope that by the end of this hour that you will understand how and why to register for the campaign, to know how the tools work and how important it is that this work can be to your QAPI plans and to the health and safety of your residents. We also want you to know that all the data that's put into the Advancing Excellence website is confidential. No one can see that information. It's there for your use and your understanding. First thing I'd like to do is start off with a poll to ask if you are registered for the campaign, and I'm going to try to bring this up. There we go. So if you will mark yes or no if you have registered for the campaign, especially if you've registered for the campaign in the last 6 months, since November. If you've not registered since November, then your answer would be no. I'm sorry, that's not true. That's not true. Just forget that. If you are registered, you are registered. I'm losing my mind here. Okay, well, I'm going to close the poll because it's a pretty simple poll. Looks like 76% have said yes and 24% have said no. So we're hoping maybe by the end of the day, 24% of you that have not voted will do so. Our next thing I wanted to mention is about the campaign. This is a voluntary campaign. There's no cost. There's this effort was put together by the stakeholders of nursing homes. If you belong to a national organization, chances are that organization is involved with Advancing Excellence, and all of those groups have come together to put this information out here to help homes and staff and residents and their families have the best possible quality of life. If you have registered by going out and getting a password, that in the past that was really all that was required, and we considered you to be a participating nursing home. The board has now changed that to say that if you're registered, then you're registered. But to be considered an active participant, you must be submitting data on 2 of the 9 goals. So the good thing and important thing about Advancing Excellence is that we are partnering with a lot of the other initiatives that are going on, including the QAPI initiative that CMS is coming out with, the nursing home collaborative that the QIOs are working on, the new partnership to improve dementia care, Interact, even the Centers for Disease Control initiative. They are going to be co-branding with us on the C. diff infections goal. We have all this information out here that has tools for the data collection. It is free, and we do provide as much help and support as we possibly can. Those of you that register and enter data, you'll be receiving instant trend graphs. No, there won't be any delay like with the quality measures. You'll be able to instantly see where you are. You'll be able to compare yourself at the state and national level, and you have the opportunity to let the consumers know what you're working on and how you're trying to improve life in the nursing home. We actually have 9 different goals, as hopefully you know if you've been out to the website. 4 of those goals are organizational goals.
Excuse me, Carol, if you can hear me?
Yes.
We can't see your slides.
How about now?
Now we can see your slides. Thank you so much.
Oh, well, shoot. Okay. So sorry. I thought I hit that button. Well, hopefully everybody has the handouts. Well, thank you for pointing that out. My bad. I will mention that that you should have received a set of the handouts. If you did not, you can contact me, and I will be happy to send those. I will also mention that we are recording today's session, and we will send that link out to everyone who watches and those who signed up but weren't able to be on the call. The 4 organizational goals, again, are staff stability, consistent assignment, person-centered care, and hospitalization. To be a participating home, like I said, you need to pick one out of the red and then one out of the blue. Of course, today we're talking about the hospitalization goal, which now is in yellow, so we don't want to confuse you, but we wanted it to be aesthetically pleasing because how much more exciting can it be to spend time talking about data, except in this case, data is going to help us perform better, and so that's what we're shooting for. So the next question for everybody is, have you tried downloading the tools and the tracking information? So please put down yes or no. We're, like I mentioned, the majority of today will be Adrian talking exactly how to do this, and so even those of you who have done it, I think will benefit greatly from the information that that she's going to be sharing. We're at about 80%. I'm going to say I'm going to close it up. I'm going to share it. So that shows we've got about, Adrian, this is really good. We've got about 56% that say no, but 44% have actually been out there and either downloaded it or started putting together some information.
Maybe trying to download it.
Yeah, there you go.
and get into a roadblock. All right.
Right. So we're at the don't panic button. I said, this is exactly why we don't need to panic, Adrian, is because we know that you've got our back. And I'm going to turn this over to you, and you can help answer everybody's question. Let me mention that if you have any questions, over on the right-hand side is the box that has all the information where you found the phone number and everything. If you want to type in your question, we will address those as time permits. And so, Adrian, it's all yours.
Thank you so much, Carol. And I really appreciate that having such an excellent group today for the entire series. And thank you, Carol, for setting us up with a great introduction. Let's see. I am just making sure that we're actually on my screen. I'm going to jump back to this slide for just a minute. When we talk about registering for the campaign, the reason that we spend a little time talking about the importance of registering for the campaign and what's required to do that is that you're going to be able to get more out of the Advancing Excellence Safely Reduced Hospitalization Tracking Tool if you register for the campaign, because you'll be able to participate fully in the campaign, and that means submitting data to the website every month. You're not doing that for us so much as doing it for yourself, because when you submit the data to the website, you're going to be able to see trends of your 4 outcomes stratified by long-term and short-term care over time, and you'll be able to access comparative data, both within your state and nationally. So again, when you do that, you have you can choose as many goals as you want, and you can begin entering data as soon as you want on as many of those goals as you want. But the minimum requirement to get started is to select 2 goals, one of the organizational goals, they're red, and one of the blue goals, and those are the clinical goals. Hospitalizations is considered an organizational goal because it works so intensively on communication and infrastructure, and really at the process level on those things, such that we expect to see widespread quality improvement. Sometimes that's called a spillover effect into outcomes beyond just reducing your transfer rates or reducing your 30-day readmission rates. So once you register, for the first year, you're going to want to submit data. And Carol, jump in and tell me if I've got this wrong, but you submit data every month on an organizational goal. Once you've got that firmly established, firmly rooted, then you'll pick up that clinical goal that you've previously chosen and start submitting data on that. Of course, you can start that anytime you want, but we're not saying that you have to jump in with both feet and then some and start up two major quality improvement projects simultaneously. So there's, just as we're going to do with the hospitalization tracking tool today, there are ways to step in with your participation. But do begin by getting registered, choosing the 2 goals, and that's going to give you access to some great data down the line. So that's why we wanted to go over this just briefly. Okay, let me activate. Okay, so on to hospitalizations, and we're not going to panic. What we are going to do in this series, and we've got 3 episodes basically, and they're each separated by several weeks. And we're going to be stepping into using the Advancing Excellence Safely Reduced Hospitalization Tracking Tool as we simultaneously work through some of the circle of success. What you're seeing on your screen now is the icon, the image that we call the circle of success, and it's the Advancing Excellence version of a quality improvement project cycle. Those of you who are familiar with PDSA, the Plan, Do, Study, Act schema, this is just an elaborated version of that. So we, exploring goal would be selecting a priority, identifying a baseline, setting a target, examining your process, and so on. Okay? My hope is that by stepping into the tool gradually, we'll be able to both ease into data collection and data entry, and hopefully that will minimize the burden associated with that component of the project, and also focus on actually using the information as we get it. And this last one is really important for us. The tool wasn't created to just calculate numbers that you submit somewhere for someone else to use or to satisfy a requirement of some kind. Although let me say that the tool will support your QAPI, your QAPI effort. They want a data-driven quality improvement project. You can show them this. That works. A number of states are incorporating this into their P4P. And so in those respects, you may have a reporting requirement that will benefit you as well. And then also, as Carol noted, you're going to get a lot out of, when we talk about submitting data to the website, there is that opportunity. And you'll get a lot out of entering just a little bit of summary information, and we're talking about 5 to 10-minute projects to do that once a month. So it's not about, recording data and then sending it somewhere just to satisfy an obligation. What this tool, even though it does some of those things too, the intention of this tool, the creators of this tool, wanted to support, to make something that was going to support your quality improvement efforts by providing you with meaningful and actionable information and something that's formative. In the schools they talk about formative assessments, and they're so that you learn about what you're doing and where you want to go as you're doing it. It's not just a test after the fact to see if the instruction was successful or not. Well, clearly because you're here, you've already determined that you want to work on safely reducing hospitalization transfers, hospital transfers.
Adrian,
Excuse
your
me?
slides are
Yes.
your slides are not changing. Seeing the goals for session 1.
It did not change from the goals. Are you seeing any change now?
No.
But you were seeing the goals.
Well, no, we saw the goals for session 1. Understand how and why. It was the first one you showed, and they haven't changed that.
Okay, it has been a little while. Let me see. Do you see the red and blue organizational and clinical goals?
Yes.
Okay, great. So that was the slide I was showing you when I was talking through the importance of why we're talking about the registering for the campaign and selecting the goals and how to do that. Okay, and then what we were looking at was the circle of success, and this is what I was just introducing as being an elaborated plan, do, study, act cycle, essentially. But it's the process that we go through with any quality improvement project, sort of step by step, and we've added in a few more engaging leadership and stakeholders and monitoring progress and so forth. And of course, it's an iterative cycle. We go around and around. And I had just flipped to this one. So I'm going to pick up again. Obviously, explore goal, because we're here, and therefore we have determined that we want to work on safely reducing hospital transfers. So we've established the priority. Today we're going to focus on using data entry, on the data entry that we need for identifying our baseline. And in the subsequent episodes of our series, we'll work on examining our processes and the creating improvement components, always bringing in the data and information from our tool to help us drive our quality improvement project. So many of you may have an idea of what your current transfer and readmission rates are, but this is still a useful step for several reasons. It gets our feet wet with data entry before we get in deeper, and importantly, it's not always obvious exactly how to do the calculation, so we often end up comparing apples to oranges. So obtaining some numbers via a standardized calculation can be quite valuable. And of course, it creates a baseline using those same calculations in the months to come. Because of the way the tool works, collecting just the required data for those basic calculations is also going to give us some collateral information that's helpful in our daily work. So we'll look at that as well. Okay, so we are going to be really talking in terms of what the homework is for the next couple of weeks. And these are the required fields that we'll be filling out in our tool over the next couple of weeks. I like to look at the list, not actually in the tool. Once we get into the tool, we're going to see a lot of other optional fields, and that can be a little bit overwhelming. So we just start with this. Now we have 3 required fields for, let's look at this. We have 8 fields altogether here, but they're not for every record. The first set are for those residents who, when you admit them to your home, have been discharged within 30 days from an acute care hospital. So typically, they'll probably be discharged directly to you, but also for a certain proportion, they may go home first, they may go to another nursing home, to assisted living, but still within that 30 days from the date they were discharged from the hospital, they spend some time with you. For those folks, you'll enter their name, the date they were discharged from the hospital, and whether they were admitted Part A or other. Then, every day, for anybody who's transferred to an acute care hospital, you'll enter their name, whether they were receiving post-acute type care or long-term type care. We'll talk more about that distinction. the date they were transferred to the hospital, and then this is the tricky one, the outcome of transfer. And we know that oftentimes you're not aware of what happens to that resident once they're transferred. You know, obviously they went to the hospital, but don't necessarily know technically whether it was an emergency department only visit, whether the resident was admitted as an inpatient, or whether the transfer resulted in an observation stay only, or in an observation stay. And so that may be a first critical task, is to establish the lines of communication so that you have access to that information. And that's good information to have on hand in any event. And then at the end of each month, you'll enter your average daily census by purpose of stay. If you don't have your average daily census broken out by long-term and short-term, you can use a mid-month census, just a count of all of the residents on the 15th day of the month in long-term, and a count on the 15th day of the month in short-term. And that will do fine for your denominator. So we're going to go into the tool live and actually enter some data in just a few minutes. But before we do that, I wanted to, and actually look at the mechanics, I wanted to show you what the screen is going to look like and just discuss this a little bit. Oops. Sorry, I'm flipping around there. Just trying to get the mouse activated. All of the data entry for this sheet is done with drop-down lists. So you click in a cell, and you'll click an arrow that appears over to the right-hand side. And then we can select the name of a resident. The same thing, and these are the 3 required fields. They're indicated with an asterisk. So remember, for those admitted with recent discharge, and if you wonder about that, admitted with recent discharge, we have a couple of places you can click for more information. Which admission should I record? So you have a hyperlink there. If you click on that, it will take you to information. And again, over the hospital discharge date, there's a hyperlink. You can click there and it will take you to that same information. The 3 required fields for the next couple of weeks are the resident name, asterisk, hospital discharge date, asterisk, status on admission to nursing home, asterisk. Since about half of you have not tried to download the tool yet, let me, again, allay panic. We are going to go up and see where to do that, and I have a whole bunch of slides at the end of the presentation that talk you through each step for the homework. And we'll save a little time, hopefully, to look through those. But first of all, I'm going to give you an introduction. If we don't get to them, know that they're there, and I'll be available to help you as well. Okay, so I enter my name using the drop-down list, type in the date of hospital discharge, and select post-acute or chronic long-term care. When I do that, once I've entered either one of these one time, I'll be able to just enter the first letter, type the first letter, and it will automatically fill in. Just this bit of data entry, it's not just used for the calculations. I already get a highlighted list. What is this highlighted list? You'll see at the top of the page today's date. This date is read from your computer. If it does not appear correct, please contact your IT department and see if you can get the date on your computer reset. It has nothing to do with the tool. It's just reading it off of your computer. Have not yet had anybody with that problem, but if you do, it'll be your IT to call. And the date that you enter here is referencing today's date. And if your resident had a discharge date within the past 30 days, they're still in a window where they are at risk of readmission. We know that they are empirically at a higher risk of returning to the hospital, and because it's within that 30-day window, they would be defined as a 30-day readmission. So printing off this list and passing it to the clinical staff so that they can use this list for what some are calling daily hospital walking rounds can be a great first course of action, sort of the added awareness. When I say about passing it to clinical staff, one of the great tips we've gotten from some homes is that this data entry is pretty straightforward. This information is very frequently available on a daily report or can be added to a daily report. Pass that maybe to a person at the front desk or somebody administrative who could enter the data for you. But you'll want to be sure that your clinical staff have access to the information and to this kind of daily feedback. So enter the information on a daily basis. That minimizes the burden. Don't let it pile up, but it also gives you the priority list. When you print that, you don't want to just print the whole sheet. It will print probably several hundred pages if you do that. You'll want to reference some instructions or give me a call if you don't know how to print just a single page or a selection. You can just copy out the part that you want and print it on another page. Is a good way to do it. Entering data on the transfer log, that's your second main data entry task. Works the same way. Now here you are only entering transfers to acute care, not all transfers out of your home, and only transfers that were unplanned. Planned transfers would be things like a blood transfusion, planned blood transfusion, planned chemotherapy, planned surgical revision, something like that. So these are the unexpected ones. It's pre-filled for you. Then just in case you wanted to also record planned, you could do that. You can override this, but it's filled in for you. I'm showing you a split screen here because there are a lot of fields in between date of transfer to hospital and outcome of transfer. So on your tool, you'll actually scroll over, and we'll take a look at that in just a minute. So here the information that you're getting real time is which events were classified as a 30-day readmission. To be a 30-day readmission, the date of transfer to the hospital, this date that you see here, here we go, this date has to be within 30 days of the date the person was last discharged from acute care as recorded on the Admitted with Recent Discharge tab. The outcome of the transfer must be admitted inpatient, or there's also a choice for uncertain. As you're getting that communication with your hospitals established, you may not know. So in the short term, if you need to indicate that it was uncertain, or if it was a special case and you were not able to nail it down and you need to indicate uncertain, you can do that. It will be counted as an inpatient admission. If the transfer resulted in ED only or an observation stay, it is not counted as a 30-day readmission. But you will get that information right there, and that's a great place to focus some first questions about what happened in examining your processes. Now, from entering, and again, your required fields for the calculations and also for our homework for this session: resident name, date of transfer to hospital, outcome of transfer, and whether the transfer was planned or unplanned, and that's pre-filled for you. The calculations you're going to get, not just your 30-day readmission rates, also the rate of transfers that resulted in an inpatient stay, the rate of transfers to ED only, and the rate of transfers resulting in observation stay. All useful information. The little picture that you see here with the numbers in it, this is actually an excerpt from the page. You're going to get one for every month. This happens to be February 2013. The denominators are in the gray box up at the top for each set. They're stratified slightly differently. The 30-day readmission rates are stratified by post-acute versus long-term, and that's defined on that admitted with recent discharge as Part A or not Part A, essentially. Your transfer rates are based on the status or the type of care being provided at the time the resident is transferred to the hospital. And that's characterized as post-acute or long-term care, but not tied to the payment status. It's more about the type of care that was being received. So it's management of a complex medical condition, rehabilitative therapy, or in fact, subacute care. you'll indicate post-acute type care. And if it's long-term care, then you would go with the chronic long-term care category. Okay, time for a live demo. I'm going to get a little more active here. I'm going to leave the slideshow. I think the first thing I want to do is take you up to the website and just quickly show you how you're going to get into the area to download your tool and your instructions. And then we're going to go directly to the tool and do a little walkthrough. Again, I wanted to remind you, and I'm going to check my chat box right now, if folks have questions as I'm going along at this point, we had conceived of this as being a kind of an informal and highly interactive practicum. It would be interesting to see how that works with several hundred people on the line, but please do feel free to just, I think we're probably going to keep people on mute because we are recording and because there are so many of us. Undoubtedly somebody will have some background noise, but feel free to chat in, and Carol will interrupt me if it's a question that we should ask in context, and otherwise we'll start going through them toward the end. And the wonderful thing...
We've got one question. I've been able to answer the others, but this one says our facility uses AHT software. We are able to obtain outcome reports for hospital readmits, infections, pressure ulcers, etc. Are we required to enter the same information again into the Advancing Excellence database?
I think it would be good if that person contacted me. And what I'm going to do right now is to just give a generic response, which is this. There are some EMRs that are starting to calculate this is a good opportunity for me to talk about the calculations. The calculations used by the AE and Interact programs, we developed them jointly with Interact, worked closely with CMS and RTI, who is developing their subcontracted, or they're contracted by CMS to develop the QM for the readmission rates. And we worked very hard to create a measure that reflects as closely as possible what they're doing with the QM, given that the QM is going to use beneficiary data, beneficiary claims data, and we don't have that. You don't have that as nursing homes. So from your perspective, with the information you know that you can reasonably collect, how to do that calculation. So at least one EMR, and it's point-click care, has incorporated the calculations into their product. Others may be doing the same thing. Whether or not the product you're using, the question becomes, it's a couple of things. One is that you may or may not be getting the process level information. That's going to be a decision that you need to make for yourself, whether it's worth doing this bit of data entry to be able to access some of the other process information, or if your EMR allows you to record the process information so that you get that too in order to work your quality improvement project. Remember, this is not about tracking those outcomes. It's about the processes associated with the outcomes and how we can intervene in them and being able to watch those change. And that's what we're going to start talking about in the next session. We can help you determine if your EMR is using a similar calculation. I have some documentation I can share with you on that, talk you through the actual calculations. It's actually included in the instructions for the tool as well. So I'm going to leave it at that for now, but you are going to be able to contact me directly if you'd like to discuss those calculations in your specific circumstances. Any other questions at the moment?
Yes, there are. One is, when and how do you remove patients from database when they are discharged to home or passed away?
We don't need to do that. And you know what, let's leave that till we actually get into the tool. So I'm going to take, since about half of the folks have already downloaded the tool or have tried that, what I'm going to do is very quickly go through downloading the tool, and we're going to get into looking at the tool. And that way, everybody's going to, will you ask me that question again when we're looking at the tool? That way, those who haven't seen the inside of the tool yet will have the visual to go with that and will understand. But the bottom line is that we don't remove people in this tool. Okay, Advancing Excellence, I have bookmarked it because I go here all the time. And I'm going to just click my link. It's www.nhqualitycampaign.org. We are in the process of overhauling our website, and what's coming up is very beautiful, even nicer than this. Has a wonderful, wonderful digital map. I think maybe one of the things that we didn't mention, one of the benefits of being an active participant is we have a very fancy software, and we're going to be rolling out a gorgeous digital map that will allow visitors to the website to identify participants, and they will be able to tell who's participating actively and those who are just registered. And when they click, you'll have a little push pin, in your state, be able to zoom in, find homes. When they hover over or fly over your push pin, it'll bring up a little calling card that you've customized with the contact information you would like to have displayed for your home. So the address, the name, as you would like to display, and including your website if you'd like. We have, according to the old definition of participation, 60% of all the nursing homes in the country have been registered for the campaign. This is where you would enroll now, this little button at the top. But we want to go to the tool. I'm going to take you in. There are two ways. The quick way for you to go in, and this is on handouts that are included in the slide deck that Carol has posted for you. The quick way to go in is right here, Safely Reduce Hospitalizations. That will take you directly to the tool. There's another way to do it, which is from the marquee here, Explore the New Goals. If you do this, then you'll go to Hospitalizations here, and it takes you in here, talking points on why we might want to reduce our hospital transfers for residents, for staff, and for the home overall. Let me make this a little bit bigger. And then across the top, this is that circle of success, but we've laid it out in a line, and there are resources under each one of those. So importantly, let me say, under the leadership, we have fact sheets, again, targeted for your leadership, your staff, for consumers, both health-related services and hospitalization costs. We'll be looking at some of these later, but right now we're under Identify Baseline. This is our project for this week, and this is where we get our tools. To download the tool, we're not clicking on the icon, but on the link itself, right here, and it will download the tool. And likewise, the instructions, it's great to print out the instructions so you have them next to you as you start using the tool. I'm going to open the instructions right now and show you that these are hyperlinked. There are links for sheet-specific instructions and for topics. But the important part is that they're all illustrated with screenshots. So it looks a little bit long, but it's a lot of pictures, as we say, with just captions, so pretty easy to use. Okay, so I'm going to open up my copy of the tool. I always orient to the version. And those of you who've used the tool already and you've got some questions, we're going to get to those in just a minute, but I want to bring the whole group up to speed, just orienting to the tool itself. And I get questions probably between 5 and 10 a day on any given one of the Advancing Excellence tools. And what I've learned is that there's always a little bit more to learn about it, and there are additional features that are easy to miss the first time around, so bear with us. Check the version number and the date. That can be important when you go up to the website periodically. We've replaced the version. Sometimes it's a material change you're going to want to know about, sometimes not. If you write into the help desk, I may ask you this. I'll remind you how to get there. There's a link on the front page for getting back up to the website. Keeps that handy at any moment. Confidentiality is important. Once you begin entering data, this does contain PHI, and you will not want to email this tool without de-identifying it or encrypting it. And we do include a mechanism for easily de-identifying the tool, and I have a WebEx up on the website on how to do that. What we see here is a directory of the tool with just a brief description for each of the sheets. So those of you who are familiar with, who aren't familiar with Excel, this entire file is called a workbook. And within it, we have worksheets. So down at the bottom, and so here's my cursor, and down at the bottom, I have tabs: Welcome, Common Q's and A's, drop-down list, census. As I move, I can move from one tab to another by clicking on the tab, and it takes me to these different areas. So I'm clicking back and forth. For most of these, you can also get there by clicking these hyperlinks. In the case of instructions, if I click that, it's going to take me up to the website, and it's opening the instructions for me. Oh, well, I guess it's opening the page. Here we go. And then I would pull them down. Whoops, sorry. Common Q's and A's. So definitely print those instructions, have them with you. The common Q's and A's, again, it's organized with hyperlinks so you can jump the sections. This is also to just kind of highlight some of the topics that are covered. Even though at the beginning you may not be ready for some of this information, I highly recommend that you look through it and just scan so that you're familiar with the type of information that's available here so you know where it is when you come back. Okay, now we're going to get into the mechanics of the tool and what we need to do to get started. The first data entry sheet is drop-down list. The first thing you're going to need to do, this area here, I'm just going to remove it so you see what it looks like. It's going to look like this when you download your copy. It will be blank. And what you need to do is to enter, and don't panic yet, you need to enter the names of all of your residents. We're not expecting you to type them all in. Your instructions on copying and pasting them from another Excel workbook, Word document, or other document, right here, if I click on this, it takes me to the instructions in my Q&A. And if you forget where that is at the top, copying and pasting, and it takes you to those instructions. Okay? So on my drop-down list, the first thing I'm going to do is, let me show you what this is like. Let's say I have it in another Excel workbook. And it's hard to tell what I'm doing here, but don't watch for a minute. Oh, nope, it didn't come in. Okay. That experiment's not going to work. There are my lists. So if you copy it, let's do this. I'm gonna so I've pretend that I have copied this from another document. What I'm going to do is right-click, and you'll have the option to paste special, and I don't for some reason, but you will have the option to paste special. And you choose paste special and then values. Let me just set this up for you for a minute. I'm going to copy it out of here. So everybody close their eyes for a minute. We're going to do magic. Okay. This is my list. It exists. I have a census for my house, and I'm going to copy it. And it could be actually in a Word document. If you have it in a Word document or in some other form, what you'll want to do is to make it electronic somehow, and that could even be a PDF. You're going to copy it, move it into a blank Excel file, like I just did with this one, and it will look crazy. It'll look like whatever it looks like. And then you're going to select it. I do Shift, Control, and down arrow. There are 100 ways to do it. I'm copying it. Now I'm going to my tool. And I'm in the, well, I've totally messed it up. Paste special, and you'll choose values. And it's going to paste the names in. And mine looks a little bit messed up because of the way I cut it out of there. But yours is going to look nice. It's still going to, we're going to get back to it, and it's going to look great. There we go. Yours is going to look like this with the lines and everything. So just remember when you do the paste, you're going to have paste special. You'll be able to see it when you actually have something in active copy. And you choose values to paste that in. So that's the first step, and that is the hardest part, is getting your names in there. You can do it with cut and paste, and I do, or copy and paste, and I recommend that you do that. The instructions are right here. The next thing you'll do is go to your Admitted with Recent Discharge tab. Remember, we just have three fields that we're going to enter: the resident name, date of discharge, status on admission to nursing home. I'm going to check today's date. It's correct. When I want to enter a name now, I click on the cell, and I can choose a name. I'm going to enter my date by hand. Remember that any date that is within 30 days of today's date will be highlighted yellow, so I know that that person is at higher risk of transfer to hospital and at risk of becoming a 30-day readmission, and I'll check whether they were Part A or not. When you get to this field, if you're not sure what to do, as you click it, you're going to get this little box with an explanation of how to select post-acute versus chronic long-term care. After the first couple of times, these boxes may become annoying. You have two options. One is to hit escape, and the other one, of course, it's going to come right back. You can grab it by just clicking it with your mouse, right-click it with your mouse, and you can move it out of the way. Okay. Every day, every time you admit a resident that had a hospital stay, please bring them on over and enter them in here. And you'll need to first enter their name on the drop-down list. So while at first your drop-down list may be alphabetical, if that's how you copied it in, residents obviously do not come to you on an alphabetical basis. This list may be sorted. There are instructions for this, but I'm going to use my Shift, Control, I'm holding them both down arrow. I'm at the bottom of my list now. Right-click, sort A to Z. Do you see how my last name down there is Anna Smith? Down here at the bottom, I go from my Y's to an A. I'm going to sort A to Z. It's going to give me a little check. Do I wish to continue? Yes, I do. And why did Anna not turn up at the top? Was she up there? Anna, where are you? Yeah, so the other thing that the sorting, and I recommend that you do this periodically if you start having any issues, it doesn't mess anything up, but if you have gaps, for example, if at some point you'd entered a person, had removed them for whatever reason, they've perhaps the individual left and you're not expecting them to come back, perhaps the individual died, if you sort, and now we're going to do this again, and Anna's still down there, and I'm not sure why she didn't sort with the rest of them. It's going to take that gap away. And I think that the reason why Anna didn't sort is that when this list got copied in, do you see there's spaces here? And that name does not have spaces. Excel actually sees the spaces as values. So she's getting sorted differently because she doesn't begin with some leading spaces. Okay, so on the transfer log, works the same as the admitted with recent discharge. Again, we have just the 4 fields we're going to work with for this session: the resident's name, the outcome of, let's see, we need to scroll over. This is a handy little bar down here. So now here's my cursor. I'm down in the lower right-hand corner, and I can use this bar to slide from left to right and get further over in my sheet. I'll be doing that in a minute. These black lines here, and there's a picture of this in your instructions, so you'll be able to review all of this. These black lines are freeze pane so that I can scroll down and I still see my headers, and I'm going to use my scroll bar now. I'm going to use this little arrow. I can scroll across and I still see my names. These are called freeze panes. Resident name, again, I'll do it from a nicely alphabetized list, whether they are post-acute type care, chronic long-term care. Again, I've got my little instruction box that shows up. If I want it out of the way, I'll just put it up there, and I will choose. I'm going to enter my date of transfer to the hospital by hand. And then I'm going to use my arrow down at the bottom and scooch over and indicate the outcome of the transfer. And that's all we need to do on this sheet. But again, if I have a transfer that was a 30-day readmission, it's going to be highlighted red. Okay, so now I want to hear that question again. What do we do if, Carol, can you repeat the question that I said we would look at once we were actually in the tool?
Yes. It was, you've got a ton of questions here. Where and how do we remove patients from database when they're discharged home or pass away?
Okay. So first of all, if you had entered them here, you're not going to remove them. This tool lasts for a full calendar year, and we're not going to take any residents out. If they had been transferred, then they're still part of our transfer rate during that particular month, so we don't take them out. If you would like to, you can remove them from this drop-down list so that they don't appear anymore. If they return to you, you'll add them back in and resort. If you remove them, please remember to select all your names and right-click and sort them, okay, so that you get rid of that space. Another question.
Will this program allow for identifying high and low risk admissions based on quantitative or qualitative predictors?
Can you say that again? I missed the last part. Quantitative or qualitative?
Will the program allow for identifying high and low risk admissions based on quantitative or qualitative predictors?
No, actually it doesn't. So I think that the person is referring to, the asker of the question is referring to sort of what is the acuity of the resident, and are there certain risk factors for returning? And the answer is no, not really. There's some things that we're going to look at in the next session that are related to identifying processes that you'll implement across the board, so that, you know, this is what we're doing. QA is looking at an individual level event, and in your case you would be thinking on the admitted with recent discharge. If I know something about this resident as they're coming in, that may help me. We are going to talk about processes that can be implemented in general, but that's not something that you're going to collect with this tool.
Okay. With entering all the admits, if the patient has not been in the hospital within the last 30 days, I leave the first box blank. Is that correct?
You don't even have to enter anything if the resident has not been discharged from the hospital in the last 30 days. Do not enter them here, because
okay.
they're not used in the calculations at all.
Okay.
They're still going to be in-house. What you can do is to add their name to your drop-down list. You could go ahead and do that. Then if they're transferred, they're already there on your transfer list. They're going to show up in your census when you enter that. We're not going to need to do that right now. You can, if anybody wants to enter data retrospectively, let's say for the last month or so, go ahead and do that, and you can come in, and these are just the two fields that you would enter here, your post-acute and your chronic long-term. Go ahead and get those entered if the month has already been completed. Another question.
For a resident that has been with us for several years, what do we put in the admission date? Would we just use the last readmission from the hospital?
No. Again, if they've already been with you for a few years, you're not going to be recording them on the admitted with recent discharge. And okay, this is only for people who, and go ahead and click on this, which admission should I record? It gives you a little bit more detail. But only those that were admitted directly from an acute care hospital, acute psychiatric hospital, so it goes into a little bit more detail. If they've been with you for several years and you transfer them to the hospital, you need them on your drop-down list. Go ahead and put their name on there. And then come on over to your transfer log. You'll select them. So I have all my long-stay residents here and my short-stay. And I'm going to choose my person. And she was long-stay, so indicate that she was a long-stay resident, had been with me for several years. And I'm going to put the date transferred. You do have the option, and this is just if you want to do it for housekeeping. This is not part of our homework this week, and nor will it ever be part of our homework, that you can record before this transfer the resident was admitted to my nursing home from, and I have a drop-down list I can choose, so you might say from home, and you can say what that date was. You can enter that, and that might have been several years ago. Okay, you can do that if you want to. Another question?
Do we take into consideration when resident or family requests to be discharged?
You will do that next time we meet. We are going to go through, let me tell you what we're going to do the next time, and then I want to go through what the homework is for this time. Next time, what we're going to do is look at the Interact QI Quality Improvement Review Tool, which takes us into a root cause analysis. It guides us through a root cause analysis of each transfer we have, and lets us consider, was this transfer appropriate? Did it need to happen? Should it maybe have happened sooner? Or did it maybe happen for, maybe it shouldn't have happened? In retrospect, shouldn't have happened, and what were the contributing reasons? What were the main clinical reasons, and what were the main contributing reasons? We're going to record that information, and we're going to add 3 more fields next week. But what I wanted this time was for everybody to get comfortable with this part of the data collection. If you are already doing this and you want to jump ahead for whatever reason, if you're anxious, you're going to contact me, and we're going to get started on the next part. What I'm going to do right now, because we just have 3 more minutes, is go back to our slides, and I want to just talk you through what you've got. Oh, I'm sorry, I'm going to go back to our tool just for a minute. Our tool, admitted with recent discharge, I need to show you something on this page. I'm going to use my scroll bar and go all the way to the right. We have 2 tables here. This indicates my admissions by nursing home admission date. We are not recording nursing home admission date for our first homework. You can, of course, if you want to, but what I want you to be able to check is this one. These are your denominators for your 30-day readmission rates. So we'd like to have the habit of coming over and make sure that our data is displayed correctly here and get familiar with what we've got. Whenever we want to check numbers for our 30-day readmission rates, these are our denominators. So we want to get used to looking at this table. The other table you're going to want to know about is this. I'm going to use, now here's my cursor right here. I'm coming to my lower left hand, and I'm using these arrows to move over. And I have a sheet for every month of the year. So let's say we just start entering in June. My June data will be here. These are my outcomes, and of course they're not populated yet. But down at the bottom, I'll have some numerators and denominators for my month. And actually the data that I entered was in May, so maybe it's going to be May or even April. But I'll start seeing numbers. If it says NA, it's not, let's see, minus, there we go. I'd only entered some admissions here, and maybe I hadn't entered my types of transfer. But you should be able to see numbers down below and make sure that the counts match. So this table says numerators and denominators. The one above probably won't be populating much yet, but your numerators and denominators should have some numbers in them, and you'll be able to see if your transfers are being recorded the way you want them to, and if not, to think about where to look to adjudicate your information and make sure it's all coming through correctly. Now I'm down to 1 minute, but we're going to go back very quickly to our slides. And let me show you what else you've got. So homework. Here's your homework. These were the goals for our session. This is the homework. Register and select goals. Download the tool. Enter only those required fields. Check the count of residents. That's on your admission sheet. Check the count of residents transferred. You'll do that on your monthly tabs, and you may have to look at several of them. And look at your results each day. Look at the yellow on your admitted sheet and the red, and that shows up your readmissions on both your admitted with recent discharge log and your transfer log. Register and select goals. Here are your cheat sheets with all the information. So it's sort of a guide to getting into the website and what you need to click on to get right where you need to go, along with information. If you write to this help@nhqualitycampaign.org, Larissa will help you get logged in if you need to. And please send her your provider number if you have it handy, and the name of your home, of course. If you're writing about a question with the tool, I'll be responding to you directly. Here's how to get in to get your tool. These are the methods we looked at today. What you need to click to download it. Your orientation to the tool itself. what you need to enter for this session, just the required stuff that we're doing this week. There's a lot involved in getting your data entry set up. Who's going to do it? Where's the information going to come from? So these are your reminder sheets, reminding you about the table that you're going to look at to check your data entry is coming through the way you expect it to. Again, the 4 required fields on your transfer log. How to scroll across using these buttons to get to your monthlies to check your transfer rates. Do not panic. Please just drop a note to, and if you want me in particular to answer, just make sure you put my name in there and I'll be the one that you hear from. And some additional resources for those who have not had an overview of the tool itself. We have that on WebEx right here, and that's for the entire goal actually. And soon we'll have one up that just covers the tool and talks more broadly all at once about all of the features of the tool. I can tell by a couple of the questions that not everybody has done that, and that's fine. We're all at different places, and we'll be getting to all of those rich features in our upcoming presentations. And also an overview of the website itself. Carol's contact information is provided right here, and mine is to the right. Thank you all so much for hanging in there. This is a lot of fun. I'm looking forward to hearing from you. And I'm sorry that we weren't able to answer all the questions, but let's do this. Please send me any comments or questions you have. I'm going to also collate those and be able to do them, anything that would apply to the group. I'll review those at the beginning of our next session. We just had a lot to get under our belts to get started today.
Yeah, and Adrian, I will be sending out to everyone an evaluation, and that will be another opportunity for you to put any other remaining questions. And any of these questions that we've already been asked, we will come up with a way to get the information back to you. Our next webinar is on July 18th, and you will need to re-register. When you re-register for that second part, you will automatically be registered for the third session. We are like I mentioned earlier, we are recording this, so if you can't make the second, you'll know that you will receive a copy of that to listen to. They will be posted on the Advancing Excellence website. So, last words, Adrian?
Just thank you all for all your hard work. And I'm so excited about the interest in this tool, and I look forward to working with you over the coming weeks.
Great. Thank you, everybody. Be watching for the registration information on the next webinar. And we're done.